How many people in the room have performed CPR on a victim? How many of you know how to perform CPR and would feel comfortable doing so in an emergency situation? Those of you who did not raise your hand could one day be in a situation when you would need to perform CPR in order to save someone's life. I am certified through the American Red Cross to perform cardiopulmonary resuscitation, also referred to as CPR, and feel prompted to inform others of this vital technique. According to CPRblog.heart.org, 70% of Americans say that they feel helpless to act during a cardiac emergency. Therefore, I will inform you of the situations in which CPR must be administered and how to determine the differences between a heart attack and a cardiac arrest, the techniques of performing CPR on an infant, a child, and an adult, and the most frequent mistakes and complications that can take place during CPR. The first point that I will be discussing is the situations in which CPR must be administered and the differences between a cardiac arrest and a heart attack. When approaching a victim, you must use your observations of the victim's condition to decide your next plan of action. In doing so, you must determine if the victim is in need of CPR. According to AHAjournals.org, cardiopulmonary resuscitation should be administered in situations when the victim appears to be unresponsive, when the victim is not breathing, or when the victim does not have a pulse palpated within 10 seconds. It is also important to decipher between a heart attack or a cardiac arrest in order to provide the best care for the victim. The first example of a complication involving the heart is a cardiac arrest. According to CPR.org, a cardiac arrest occurs when the heart malfunctions and stops beating unexpectedly. It is an electrical problem. The symptoms of a cardiac arrest include unresponsiveness, not breathing, or gasping. According to CPR.org, within 1 year, 475,000 Americans died from a cardiac arrest. The second example of a complication involving the heart is a heart attack. According to CPR.org, a heart attack occurs when blood flow to the heart is blocked. It is a circulation problem. The symptoms of a heart attack include intense discomfort of the chest or upper areas of the body, cold sweats, and/or nausea or vomiting. Unlike with cardiac arrest, the heart usually does not stop beating during a heart attack. We have now learned when to perform CPR based on the observations of the victim's conditions and the difference between a cardiac arrest and a heart attack. We will now look at the techniques of CPR performed on an infant, a child, and an adult. CPR techniques that are to be performed on a child and adult are different than the CPR techniques for an infant. According to www.redcross.org, there are 3 simple steps in providing CPR on a child or adult. The first step is to check for breathing and a pulse. If there is no pulse, you will begin CPR by giving the victim 30 chest compressions by interlacing your fingers and pressing your palm below the sternum. According to consumerhealthday.com, you will give the victim chest compressions for 100 beats per minute or to the beat of the song Staying Alive. Allow the chest to completely rise between each compression. After you have given 30 chest compressions, you will tilt the victim's head back and give 2 rescue breaths. Look for the victim's chest to rise between each breath. You will then return to step 1 and repeat until emergency personnel can take over. Likewise, according to www.redcross.org, there are 3 simple steps in providing CPR on an infant. The first step is to check for breathing and a pulse. If there is not a pulse, you will then begin CPR by giving 2 rescue breaths through the infant's mouth and nose. After you have given the 2 rescue breaths, you will then use 2 fingers to give 30 chest compressions. You will then return to step 1 and repeat until emergency personnel can take over. We have looked at the different techniques of CPR for an infant, for a child and for an adult. We will now learn about the most common mistakes and complications that can arise while performing CPR. According to www.cprcertificationonlinehq.com, there are several complications and mistakes that can happen while performing CPR on a victim. The first mistake that can be made is not counting out loud. When the rescuer does not count out loud, then he or she could lose count of how many rescue breaths or chest compressions that he or she has performed, as well as making it harder for the next person who will be taking over to know where the previous rescuer left off. The second mistake that can be made is not pressing hard enough on the victim's chest. It is important to press hard on the victim's chest in order to reach the heart. Do not be surprised if you hear a cracking noise when giving chest compressions. It is common for the ribs to break if you are pressing hard enough on the victim's chest. Remember that a victim can survive and recover from broken ribs. However, a victim cannot recover if their heart stops beating. Now we understand the importance of correctly administering CPR. In conclusion, we have learned about the different situations in which a victim might need CPR, the differences between a heart attack and a cardiac arrest, the techniques of performing CPR on an infant, a child, and an adult, and the major complications and mistakes of performing CPR. By learning the correct techniques of performing CPR, you should now be more equipped to save someone's life if necessary. After learning these techniques of CPR, how many of you feel more comfortable with providing CPR on a victim? Thank you.